Female athletes and their participation in sports have increased over the years. One of the most notable consequences is sports injuries at an earlier age. We asked Dr. John Schlechter of Children's Hospital of Orange County how to prevent these types of injuries.
Since the early 1970s, there's been a huge increase in the amount of girls who participate in sports at all ages, from the very young, 2-3 years old, all the way up to adulthood. The types of injuries you see in female athletes varies based on their age. So once the female cycle starts, which is usually around 12 or 13 years of age, and that can be a year or two earlier given different circumstances, the injury patterns tend to change. In younger girls, you tend to see more overuse injuries from playing the same sport over and over, multiple events, multiple exposures throughout the year. In the older girls, you start seeing the same injuries starting to occur over and over, most notably anterior cruciate ligament tears. The anterior cruciate ligament is a small little rubber band that is in the knee that helps stabilize the two bones, the shin bone on the thigh bone, and it creates a stable construct within the knee, or the ability for people to play sports, run, cut, and change directions quickly. Without it, the knee can give out and cause other further injuries to the knee and difficulty for the athlete to participate in sports.
We asked what are the kinds of sports that typically cause an ACL tear.
The sports that typically expose a young female athlete to an ACL or an anterior cruciate ligament injury typically are the cutting and pivoting sports. Usually soccer, basketball, and volleyball are usually the highest risk sports for an ACL tear in a female athlete. In the past 30 years, there's definitely been an increase in the amount of ACL tears that occur in female athletes. That definitely has to do with the amount of female athletes that now are involved with sports based on their ability to participate in different teams. However, their build, how the female body is made up, we think has to do with why female athletes tend to tear their ACLs at a higher rate than men, potentially hormonal differences between men and women. It's been estimated that females have an 8-time higher risk of tearing their ACL when participating in the same sport of a boy at the same age. And if during the initial event the only injury is a torn anterior cruciate ligament, then if they continue to play sports, cut and pivot without it, they can tear other structures in the knee, such as the cartilage or the meniscus, which is a small shock absorber in the knee.
And what is the treatment for an ACL tear?
Possible treatment options for an anterior cruciate ligament tear could be a reconstruction, where we take tissue from another part of the body and replace the ligament through small tunnels within the thigh bone and shin bone to reconstruct the ligament. The rehab process after an ACL reconstruction is approximately 6 months to a year, depending on the athlete and the circumstances, with most athletes returning to sport. Once the anterior cruciate ligament is gone, although reconstructions have very favorable outcomes, indeed the knee will never be exactly how it was, but many participants are able to return to soccer or basketball at their pre-participation level and compete. However, they're still at risk for further injury again and re-rupturing that reconstructed ligament or the other knee, which happens in many cases.
And how can an ACL tear injury be prevented?
To prevent these injuries from occurring, one of the most important things I feel could help is education. Educating the coaches, the parents, and the athlete as to what an anterior cruciate ligament is, letting them know that there is an increased risk in the female athlete, and potentially through conditioning, through training their muscles around the hip, the core of the body, and around the knee, learning how to run and cut and land differently could potentially decrease the risk. And there's been many studies in the literature supporting those statements.